Hi, welcome back to my YouTube channel. My name is Adrian, and in today's video we'll be discussing PCOS. Now if you're interested in hearing about PCOS and my diagnosis, please stay tuned, and in the meantime please don't forget to like, subscribe, and let's start a discussion below. The topics that we'll be discussing in this video is PCOS and some of its symptoms, my diagnosis, my doctor's recommendation, and how I've been coping thus far with PCOS, and basically what I'm doing. Now let's get into this video. PCOS is polycystic ovarian syndrome. Some persons call it PCOS for short, and in essence it is a genetic, hormone, metabolic, and reproductive disorder that affects women. It also causes infertility in women, so it's best for you, once you've been diagnosed with PCOS, to start putting protocols in place to combat it. Secondly, there's no known cause of PCOS, what causes PCOS, and there's no medication that can get rid of PCOS. No, there are some persons that say that a healthy lifestyle, or a healthy diet consisting of nutritionally dense foods can get rid of PCOS. I don't know that for sure, but I do believe in that sentiment, so it's worth a try in my opinion. Now let's move into the common signs and symptoms of PCOS. I got my list right here, please bear with me. So the common signs and symptoms of PCOS is irregular periods, excess facial and body hair, severe acne, cysts in ovaries, insulin resistance, anxiety and depression, infertility, weight gain, and male pattern hair loss. Now I've experienced 6 of these common signs and symptoms, and those are irregular periods, irregular period, severe acne, some small cysts in ovaries, insulin resistance, anxiety and depression, and weight gain. In terms of infertility, I do not know. I'm not trying to get pregnant or anything to that sort, so I would not know at all. Also, in addition to those common signs and symptoms, I do experience major fatigue, and I do experience loss of interest in things that I'm doing. So forgive me for saying this, but right now I'm doing this video and I'm extremely fatigued, and I have issues focusing on what I'm doing and saying right now. Like, this is the truth, and this is exactly how I'm feeling, and I'm just trying to gather myself and say, let's go through this, because this is the this is the 4th time I'm doing this video. I'm not doing it again. I love you guys, but I'm not doing this video again. So I'm just gonna be a trooper, and that's what you have to do with PCOS or any other form of disease or disorder that you have, is that you're gonna have to push through. You're gonna have to troop along because you got things to do. So let's go into my diagnosis. I was diagnosed with PCOS November of last year. I was officially diagnosed with PCOS in October of last year. Now, I had an inkling of what was happening earlier in 2020, and just to note that prior to 2019 or late 2019, I had no major issues with my cycle. My cycle was regular, came every month, lasted for 5 days, sometimes 3 days, never missed a period, never had a prolonged cycle. It was just normal. Sometimes pain, sometimes no pain. I had a normal cycle leading up to late 2019. Late 2019 was when the irregular period started, and it started around November of 2019 when I missed a cycle, and then I was freaking out because I thought it was something else. What prompted me though to go to the gynecologist was just for the plain reason that I wanted to do a checkup, and I felt like, hey, you're an adult now, which I was an adult from before, but I was like, listen, it's time for you to woman up, be an adult, and get yourself checked. So I wanted to do an extensive blood work. I wanted to do a pap smear. Yes, I've never done a pap smear in my life until early last year. Don't at me. I know a lot of you out there have never done a pap smear, so don't come at me. I said it. Went to the gynecologist. I don't necessarily want to state who the gynecologist is. Maybe not yet. I don't know. Yeah, I don't know. But I'm not going to mention who the gynecologist is. But I went to the gynecologist. A very nice place. He came recommended, and went there explaining why I'm there, what I want to do. I've never been to a gynecologist in my life. I've never done a pap smear. I've never done a checkup, and so all of this is new to me. So he said, okay, he did the pap smear and he did the checkup. So after that, we're sitting there and we're discussing his findings. He told me that within the next week, I will get my results for the pap smear. They will contact me and basically let me know if everything is good. He then went on to telling me about the diagnose, his findings from the examination. And he then told me that he felt something that is suggestive of a fibroid. So then he proceeded to ask me questions if, I feel pain during sex, is my belly growing or, getting bigger or anything to that sort. And I was like, yes, to everything he was saying. And so he was like, okay. Now, when he told me that I had fibroids, I was like, okay. He said, okay, well, we're going to do the extensive blood work because he needs to find out more details, and he wants me to do an ultrasound. So I said, all right, cool, let's do this. I left there feeling a bit confused and defeated in a way because I just didn't know what I'm going to do with this now. But I was like, fine, I'm going to do the blood work and the ultrasound and then just get into this. So I took forever to do the blood work and the ultrasound, but eventually I did it. My blood work came back and everything seemed to be okay. But in terms of my hormones, don't quote me on this, my FSH and LH levels were out of whack. And so he said because of this, because it's out of whack, it is suggestive of PCOS. So I was like, what? So I was like, doc, which is it? Is it fibroids or is it PCOS? And he said the ultrasound will confirm whether it is fibroids or PCOS. So I need to get the ultrasound done. Now, when all this happened, I think this was about July, August, around that time. And sad to say, I stalled on getting the ultrasound done. I don't know, I just got busy. To be honest, depression was taking me over and I just didn't feel motivated to get it done. And I just didn't, truth be told, I just didn't feel motivated to get it done. But what motivated me to get it done was the first month my period came and I was like, yes, my period is finally here. I'm so happy. Let's get this going, girl. We're going to get back on track. And I'm going to tell this doctor that don't worry to do the ultrasound. I'm good because my period is here. No. 1 week passed and I'm still seeing my period. 2 weeks passed and I'm still seeing my period. 3 weeks passed and I'm still seeing my period. And in the 4th week of me still seeing my period, I was talking to my sister on the phone. Now my sister, she has, I don't want to tell a lie on her. I think she has endometriosis, and PCOS, or it's just PCOS alone, or it's just endometriosis. She has one or both of those diseases or disorders. And so I was talking to her about it, and I was like, how did you cope with it? And did you have the prolonged bleeding and stuff like that? Because I'm freaking out now because this has never happened to me. And she said that, yes, that's happened to her. And she's living abroad, by the way. And her doctor gave her a pill, and she took it, and within the day, her cycle stopped, right? So I was like, what? I want this. What's the name of it? And she said, she can't remember the name of it, but it's not an over-the-counter drug. It has to be prescribed. So I need to talk to my doctor. So I brave up, got in contact with my doctor, and when he called me, I explained the whole situation to him, and he was like, he made a big sigh on the phone, and he's like, Amoy, you need to get the ultrasound done. And I was like, yeah, I know, I'm going to get it done as soon as I stop bleeding. TMI, but that's what I said. I said, I'm going to get it done as soon as I stop bleeding. No, this happened in early November. So I waited basically until the end of the year to get all of this done and to be completely diagnosed with something, or to be officially diagnosed with something. So, no. Yeah, it was November. I think I did it. Yeah, it was November. So it wasn't October, it was November I was officially diagnosed with PCOS. So he recommended an over-the-counter contraceptive in the meantime until we officially know what is happening with my body. So the over-the-counter contraceptive that he recommended was something called Mini Gynon 30, and it was cheap. Like, I went to Fontana the next day because I spoke to him in the evening. I went to Fontana the next day. I did not hesitate. I went there after my workout, and I bought it. And when I asked for the price, they said, oh, it was $200 and something, probably $260 something. I was like, okay, this is not bad. I took it 1 day, 2 day, and and by the second day, my cycle stopped. I literally felt as if I could cry, because the relief, the sweet relief of just not seeing blood anymore, of not having to continuously buy pads, of not feeling so fatigued and depressed all the time, it really felt good. And I didn't know that I'll ever say this, but thank God for contraceptive at that time. No, I'm not somebody like that likes contraceptives. I have a strong disliking for it, and no judgment to you women who do take it, but I don't know how you guys take it willy-nilly. We don't know how to take it just so, or anything to the sort, because it comes with some side effects. Not strong side effects, but some little things but just not. I prefer natural to my body. So kudos to you women that take it. But so anyways, I went and I did the ultrasound at ILAP. It's a very nice place, and the ultrasound wasn't expensive either. I think it was between $7,000 and $8,000. It was in that range, I think. And I actually love that place. It's really nice, and I will go back there. It just feels nice and fancy, and you feel extra special, and I like that place. So I'll go back there if ever I have to go back there. So I did it, and I asked the doc there when he was doing the ultrasound to, can you tell me what's going on? And he said that he's seen a fibroid. So I do have one fibroid, and not more than one fibroid, and he's seen signs of PCOS. So I said to him, so basically you're saying that I have PCOS and a fibroid? And he said yes. So I was like, okay. And he said, they're going to send that information over to my gynecologist, and then my gynecologist and I can talk further. My doctor's recommendations. He was basically saying that I need to exercise and eat right. I was saying in my head, doc, that's easier said than done. But anyways, in terms of medication, he recommended a different contraceptive, which is Diane 39 and metformin. Yeah, so before all of this, when I was doing some research on PCOS and I was looking at PCOS groups and stuff like that, they were trashing metformin in the group, and they were telling persons not to get it. The side effects is not good, and how it made them feel is not good, and it's the worst thing ever. And I was freaking out when he said he's going to recommend metformin. So I was like, no, I'm that person that prefers to go the healthier route first and then the medication. Now, metformin is something that diabetic persons use to help lower their insulin, or you just say the blood sugar, but in this case lower the insulin. The thing is, I'm not a diabetic, however it was recommended to me to help lower my insulin levels. And so I decided, like, okay, I'm going to try it for a month, see how it affects me, because I was talking to my sister about it, and she said that she uses metformin and it's the best thing ever for her. She has no side effects, and it's basically maintaining her blood sugar levels. So I was like, all right, I'm gonna try it and see how it goes. I bought it, and I think the one that I got is called Glucophase or something like that. Glucophase, something like that. Since I was officially diagnosed with PCOS and fibroids, I have been in total confusion. And I have been doing a lot of research. I have been watching a lot of videos, reading a lot of blogs, doing a lot of trial and errors with my diet. And I've just come to the realization that I need to eat fibrous, nutritionally dense foods, to cut back on sugar a lot. I also started a low glycemic diet, low glycemic diet, and it's a mixture between low glycemic and keto diet. So there are days when I will eat no carbs, and there are days when I do eat carbs. It's like bulgur, quinoa, ground provisions, yam, banana, sweet potato, oats. Can't forget oats. Oats is like my OG. Whole wheat pasta, if I do decide to eat pasta, but I do try and avoid it. But anything that is whole wheat, whole grain, I do eat those. That is what is low glycemic, because it slows the release of the sugar in your bloodstream, which has been working out for me. I do feel as if I thrive best on that type of diet, and I do feel as if I'm able to sustain it, and I think I'm doing well thus far. Now, in terms of if I'm losing weight, it's here and there, because as I said, it does make it hard for you to lose the weight, and I'm just making sure that the starting point of my peak weight peak. So when I went to the doctor, I weighed in and I was at like 217, and when I started the gym I was at 217. And so because it's so easy for me to gain weight, I'm trying not to go above 217, and so far I have been fluctuating between 217 and 213, 217 and 213. So for some there, that would be like, that's no progress at all. But for me, I am extremely happy, because I was not at 217 a couple months ago. I just gained this weight. It's like it does come on me like a backpack, and just say, hey, I'm gonna sit down here. I ain't moving, because I have been going hard in the gym. Hopefully by my birthday next year, which is April, I'll be able to manage PCOS. In terms of the weight loss, I'm not sure if I would lose a dramatic amount. I'm praying, I'm hoping, and I'm sending it into the universe that I would lose 20 pounds, at least 20 pounds by April next year. No, sorry. By April this year. By April 2021. Let me take that back. I take it back, and then I'm putting it back out there. I pray that I lose 20 pounds by April 2021. Please, no confusion. So anyways, let's get back to this. So your own research, do your research on PCOS, create awareness for PCOS, because a lot of females, are affected with PCOS, with endometriosis, with fibroids. They're walking around with it. They're feeling depressed and anxiety and moody. Moodiness is a major part of PCOS. Is a major part of hormonal imbalance on a whole, and a lot of women are walking around with their hormones out of whack, and so it is affecting them in their relationships, in their daily lives, in their work lives, and how they go about doing certain things. So women, I do recommend that you go out and get checked, get your blood test done, get in contact with your gynecologist, be best friends with your gynecologist, especially when you reach a certain age. When you reach that 30 mark, things start to change and your body starts to change. So I do recommend that you get yourself checked and you get your pap smear done. So kind of fast forward a bit or rewind a bit, I did get back my results for my pap smear and everything was good, everything was clear. I was in the all check. Goodie was good. Okay, so yeah, if you do want me to talk more about the supplements that I've been taking and the herbs that I've been using to help manage my not only insulin level but my stress level as well, because your stress level does affect your hormone, and just all the herbs that I've been taking, then I can do another video on that in detail. Right now I'm trying to manage it. I'm not trying to necessarily lose weight. That would be nice, but I'm really trying to manage it. I'm trying to balance my hormones. I'm trying to get back on track. So yes, thank you for staying tuned. Thank you for watching this video till the end, and I really hope that this video will help bring awareness to PCOS and to other forms of diseases and disorders that women go through on a regular basis. And yes, thank you for watching, and I'll see you in my next video. Bye.